Hi, this is Chandana again. As I mentioned, the two groups I talked about, a group of parents, I come across one is having the fear of having your child getting diagnosed, and the second group is the fear of the child not having the diagnosis soon enough. So when I talk about that is very very essential for as a parent you to need to understand, because for years I had done early intervention, and I do of course see little kids over here too, in the clinic. I had to stop doing early intervention because I could not handle. I realized having, because I do see children through telehealth, so that I can see them what needs to be done at their environment, in their environment, what they can do. And also I work with them here, because the problem is the amount of services I can provide being here from here, that limits a lot if I'm traveling, because I want to help as many children possible. So that's why I try to reach throughout the world, to all the kids, so that's my whole goal, to reach the parents so that we can help all the children who need to be helped, having the right help. That's the key. Okay, so what I was talking about, I don't want to get sidetracked because I have so much to tell. The whole thing is what I was talking about, the fear of the child not being diagnosed like soon enough. When I am saying, always remember one thing: if your child is below the age of 3 and you see real there is a delay is going on, and so the definitely, because parents, they are able to notice that. And if you go to a primary care physician, and basically the early intervention group is going to come to your house, and they will be like, whoever OTPT speech, what depending on the delay, everyone will come for screening, and they evaluate and see if there is less than 30%, then your child is not going to be receiving any service, but or else they are going to receive service. So if then you are getting all the services, but most of the time that's not the case, because there are not too many early intervention provider. Because when I was doing early intervention, parents were pretty upset when I quit, because I never saw the child for only fine motor, which I have mentioned before. Didn't matter if the child has a gross motor problem, fine motor problem, speech problem, feeding problem, whatever the problem, I work for everything, because I know everything is all tied together. But that doesn't happen. So they have limited providers, so they are not getting. So what happens most of the time, parents, they are looking for solutions. So they are in a hurry. They want to have a diagnosis. So they are hoping that by having the diagnosis, my child will have more help. So whenever they are going to so diagnosis means, when I'm talking about that, we are talking about the diagnosis that they are going to specialist clinic. And sadly, the specialist clinic, when they are going, the child under the age of 3, they are not very equipped to give the diagnosis of a child, because at 3 years, under the age of 3 years, under the age of 3, the child is going there. Most of the times, parents, they are traveling quite a distance, and the child is not in the right, is not going to behave right to be able to participate. Doesn't matter whether the child has problem, not have problem. They're already, and if the child appears like has some problem, they might have some sensory issues. So if they're having some sensory issues, and they are going to not act right, so in the specialty clinic, they are not going to differentiate if the child has sensory issues or the child has autism, because to be very truthful, I don't think they have that awareness. So they are checking a checklist. The child is throwing temper tantrum, not copying, not doing this, not that, speech delay, diagnosis of autism. I have seen so many here, because when the child walks through the door to come to me, I'm doing evaluation, has a diagnosis of autism. I'm like, what? Where did you go? How the child got diagnosis of autism? Because I don't see any signs of autism other than the child has some sensory issues. And this is something, then parents, they tell me that what the issue was, because they saw some signs of some problem. They did not know what is the problem. They cannot say, they're like a little bit temper tantrum the child is having, but there are a lot of factors playing role there too. If the child is throwing temper tantrum, I have noticed the parents are divorced, so they are working in the very difficult hours. The family, a lot of family issues going on. If all this condition we are surrounded with and are expecting a little child to behave appropriately, it's not going to happen. We have to take all the factors through consideration. So why the child is behaving, what is going on. But whatever the case is, so when the child is going to this little small room with so many people doing different kind of testing, it's going to freak out. Has nothing to do with anybody, will not have any eye contact, nothing, just running around and screaming. So when I ask the parent, then the parent is saying, so that, because they had most of the time parents, they are afraid that they have that fear that if I don't go, if my child has, first thing, because these are young parents, so they are curious, they're worried, they do not know that the child might have autism, they are going to miss out, and they get the diagnosis of autism. And this child is highly intelligent, but this is something, it's not one case. I can go on and on, because the whole point is, if the child has some delays, can be worked on for early intervention. We do not have to. What happened? The child has some behavior issue, something is going on. On top of that, the child also is in a group of getting therapy with children, with a lot of children with autism, with a lot of behavior issues. So when I saw him, he's trying to copy some of the behavior. I asked her, did he go to somewhere? So yeah, he went there and he saw another kid is doing and he's trying to mock that and copy. So this is something I always tell, because we need to having a fear that if you are having a concern, your child has something going on, then you need to go to your primary care physician and mention, and you want the early intervention therapist to come to work with your child. That will be a best idea, best solution, rather than going, because no matter what, if the child is under the age of 3, because I truly believe in early intervention, quicker we can help, because as I said again and again, I do not treat the diagnosis, because diagnosis had nothing to say. It's a name, it's a cat or mouse or dog. It is nothing to do with that. It has to do with what symptoms you are seeing, what's going on, what is the underlying problem. We have to take care of that. So whether the child has a diagnosis or doesn't have a diagnosis does not matter. Only lets your child having diagnosis, when child goes to school, access to lot of all the therapy, whatever therapy is essential in the school. That'll be another chapter I'll talk about some other time. But the thing is, we have to bear the responsibility. We have to understand how, yes, every time whenever I'm working with the parents, they always ask me this question. You are the therapist. I am not. But first, always I say the same thing. Yes, I'm the therapist. That's why I'm going to guide you through what is the best for your child. I will show you the path. I will guide you through everything what needs to be done for your child. But you have to let go of your fear and be part of it with me. That if you cannot work with, can anyone do a miracle just by seeing your child for 1 minutes? No one. That is not possible. Your involvement is 100% crucial. So in that fear, the children get diagnosed so quickly, because if the child needs help through early intervention, primary care, they are giving the diagnosis of delayed development the child is getting, and that is good. Let the child have all the things one needs to before we get to jumping into quick diagnosis, because the child has behavior, all the they have started developing established behavior is going to happen. But if the child has sensory issues, things are going on, it will be difficult. But this is something you need to be aware about. If we jumped, because this is the example I gave you, this kid who got, then the parents are like, the child, they are saying, no, I don't think my child has autism here. But they have given the child diagnosis of severe autism. Should I go? What should I do here now? Because I just went there that day, he was throwing temper tantrum. This is something we need to be aware about. And they did not know what to say. As I said, they're young parents. They do not know this is something. But to their consolation, they came to me when they are coming. I said, don't worry about whatever the child diagnosis has. What are you going to do with that? We need to take steps now. What are the things you are having difficulty? Let's move on with that. Let's work on with that. So having a diagnosis quick enough, we are thinking that we are going to provide so many variety of things, that is not going to help. Because I have noticed many times parents, the children I see here, they have received therapy all there, like 3-4 years old, they have receiving speech therapy, ABA, developmental therapy, occupational therapy, but not much of improvement has happened. So many things are going on. We need to focus what we want to do, and you being part of it. You need to carry it out. If any therapist is doing things and they are telling you you are not welcome and you need to wait outside and not involving you, then you know that therapist, that's not right. Because you have to learn with your child, doesn't matter how old your child is, that you need to be able to carry it and apply it at home. That's the first thing I teach the parents. Because you cannot just come here, drop your child and go somewhere. I want you to be present. I want you to learn what I do. So this is something we need to be aware about. Because when we are in a hurry to get a diagnosis, thinking that we will have a lot of help, that creates trouble here. Lot of kids, very, very young age, they are getting diagnosis, whereas because when we have the diagnosis, many times parents, I see a little boy, when he came to the diagnosis, he shows all the signs and symptoms of autism, and but the thing is, having the diagnosis, it looked like parents are there in comfort, that thinking, okay, now what to do? My child has autism. I said that means you have to be more involved. It means everybody has to be involved anyway. Now the things usually we talk to a child to do one time to you got the diagnosis, it's good, that's fine. Now you have to repeat it 10 times for him to probably get it. It's not that our responsibility is over. It become more now, because we need to be part of this. So this is something is essential, because it is not that we had the diagnosis and done with. This is having it, because as the child gets older there and having the proper treatment, their developmental, lot of development happens, they change their behavior and things changes. So by looking at that, the approach to have the diagnosis changes. So having such a young age diagnosis, like 1.5 year getting diagnosed with autism, is, I do not, there are a lot of things going on. We need to take care of that before you get the diagnosis of autism. Very quickly, we are jumping to the conclusion. Let's give few years. See. Because anyway, the child will be getting help, because there are delays are going on. The moment we get the diagnosis of autism, we are creating a big limitation there. That what to do? Child has autism. No, we have a lot to do. If the child has autism, that's fine, but we have a lot to do here. We need to understand what's going on. Okay? So this is something which I talk about. So think about it. Early intervention is the best. That is definitely the best. Your child can access to early intervention uh, through your primary care physician. You do not need a specialist diagnosis. You can wait for that. That can happen later. Okay. So this anyway, both ways are what I mentioned is I have given you the situations. So you need to understand, you make the right choice. And children below the age of 3, I see them here too. Physicians request for me to see. So that's no problem. That can be taken care of. Parents that drive 2 hours to come to see. The parents they do telehealth to see. So it doesn't matter. The whole purpose is doing the right thing. So no matter what we do, so we need to recognize what we want the best for our child or our children. So this is your decision, and you are powerful. You can do it, and you might need help. That's okay. And but most of the time, being a parent, we think we are powerless, which is not right. Because yes, there are therapists, there are things are there, but you have to be knowing exactly what's going on and asking question. That's the key. You need to do that, because that's what I always say. What question did you ask? What they are seeing? Why did they say? How did they know? Because this is something we have to do. Okay, then only we can have the best result. No matter what it is, parents, I am here for you. Anytime you have any question or anything regarding, you can definitely send the message or call our office, so I can help you with that. And see you next time. For the timing, bye now.